Good morning, good afternoon, and good evening. Welcome to the 897th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today, our guest is Dr. Prakash Rao, BA MD, holding a postgraduate diploma in physical medicine and rehabilitation. Undertook projects with UNICEF and AIDS Control Society, and the winner of many awards for the outstanding work for homeopathy. More than 30 years of experience at Central Council of Homeopathy, India. The topic is management of hemophilia with homeopathy, final part. I think our guest is not yet joined. So a lot of deliberations and discussions were done during this last around 5 parts of presentation, wonderful presentation. And of course, to content those who are always looking for research studies. Of course, homeopathy is, we cannot connect or we cannot bind homeopathy with the normal mechanism. We have to derive a separate mechanism for homeopathy to study the researches, because each and every case is totally different. Each and every human being is totally different. A case control study is most important. I think anyway, Dr. Prakash Rao has done a lot of work in this aspect, and he did succeed at that too in an institution, a prestigious institution where the allopathy is the medicine. They're practicing the Jawaharlal Nehru Institute of Postgraduate Medical Science, JIPMAR, Pondicherry, the most important as well as a prestigious institution in India, where a homeopathy physician is conducting a research study. That is most important thing. So we can wait for him. Doctor, he says not joined. That's a problem, and wait for that. I think Dr. Beatrice Chester can have some addition on this aspect regarding the interactions between the homeopathy and allopathy in Germany. Yes, how it is progress.
Yes, thank you, and hello to everybody. Here in Germany, we used to be friends. We had a very good situation growing in the last 30 years. In the beginning, the allopathic doctors were a bit with doubts, but later it developed a very good quality here, and I can say we have been friends. And for our patients, that's very good situation. Like I'm an allopathic doctor also. We all in Germany are allopathic doctors, and a few of us were going in another second direction. So for our patients, it's very nice. They can come, they can hear what we are saying, they can hear what other allopathic doctors are saying, they can make up their mind. And I can really say I have my clinic now since 29 years, nearly 30 years. And what's so nice, I can see the patients, they stay with us. They make a good experience. Mostly in the beginning, they come with the children. Later, they come with the mothers. Later, the husband is coming. And they make good experience, and normally they stick to us. And so we have long-term cases. We can follow 20 years, 30 years to see how homeopathy, how the beauty of homeopathy is seen in our patients, and how we can, like in my clinic, I treat 95% with homeopathy. Yes. Twice a year, I give a antibiotic, but I have to call the pharmacist because I'm not very to know which kind of antibiotic. So we keep on going with homeopathy all the years, and people feel safe here.
Yes. Thank you, madam. Yes. Of course, today is the world's Valentine's Day, and of course, we should have the romance to homeopathy. Thank you for your participation. Now, our guest, Dr. Prakash Rao, joined. Yes, welcome you, sir. Please proceed. Yes. Yes, sir. Dr. Babra, could you please make Dr. Prakash Rao co-host? Yes, sir. Yes, you can proceed, sir. Please. Yes, sir. You can use another 45 minutes for this, sir. Please.
Yes,
proceed,
sir. Yes, sir. Joining, sir. Can you hear me, sir?
Yes, of course. You can hear, see everything. You can enjoy you. Yes, sir. Please.
Can you see my slides, sir?
Yes, sir.
Slides.
Not a started. You just open the screen. Yes. Please proceed, sir.
Just a minute, sir. Just a minute, sir.
Okay. No problem, sir. Of course. Homeopathic physicians should have the patience also. So no problem, sir. Please proceed.
Yes, sir. Sir, yes, sir. See, we have to paste it in the computer. Then only they will come.
Sir, file 16, CME for mentioned there.
Yes.
Yes, there. Yes. Please open the file, sir. What happened?
Ah.
Yes, sir.
Now, can you see, sir?
Yes, it started.
Now,
Yes, sir.
started, sir.
Yes, good.
Can you hear me, sir?
Yes, sir.
Can you hear me,
Hemophilia.
sir?
Yes, sir. Hemophilia. Pre.
Society of Puducherry.
Yes, sir.
Sir, this is 14th of February, Valentine's Day. Homeopathy and Valentine's Day go hand in hand. The moods, all the complexions of the moods will go hand in hand. There are various medicines in homeopathy. So on this occasion, we also share our happiness that the Hemophilia Society of Puducherry, our president, Dr. Nalini, pediatrician, and we all together got the Padma Shri Award for 2020. So this is the Hemophilia team of Puducherry, where the president of Hemophilia, she, Dr. Nalini, has, she is Dr. Nalini, Professor Nalini, president of Hemophilia Society of Puducherry. She got Padma Shri Award this time. So, sir, now the time is 8 o'clock, 8 minutes PM. Now, let us me rewind for about 10 minutes, about 5 minutes. And in all conditions, except a few rare disease conditions like hemophilia, it is a genetic disorder. And so this runs in families. The most affluent family is Elizabeth of UK. Their family are total hemophilic patients. So the basis of hemophilia, just I will discuss. The system, it is blood vessel system, hemopathic system is involved, where the types of bleeding disorders, that is because of the normal physiological dysfunction, that is hemophilia factor 8 and hemophilia B factor B deficiency will be found. That is the hemophilia carriers, the female patients are responsible. These are all types of bleedings will come under hemophilia, genetic disorder.
This is also a kind of genetic disorder, always losing the connection, network connection is the problem.
Yeah.
Yes. Yes. Its audio connection is lost. So we can wait for that.
Sir, can you hear me?
Yes, sir.
Yes.
Please proceed, sir. Yes, sir. Please.
Yes, factor 8 and factor 9. Yes. Signs and symptoms of hemophilia are joint or muscle bleeding, joint, knee joint pains, tingling and bubbling sensation, stiffness of the joint, pain in the joint, swelling of the joints, and these swelling will be under the skin. There will be bleeding, and there will be muscular swelling. There will be mild temperature. There will be skin discoloration. There will be heavy bleeding or bleeding that lasts for a long time. The bleeding and clotting time is around 3.5 minutes to 4.5 minutes is the maximum time. And if the blood is not clotting before 4.5 minutes, we have to suspect the hemophilia. And bleeding from mouth, from gums, from tooth, so bleeding in the urine and nosebleed. Usually children will have adenoids. From adenoids, when they prick the adenoid, there will be bleeding. And if that bleeding not controlled within 4.5 minutes, we have to suspect, we have to take family history, and then we have to suspect for hemophilia. The incidence of hemophilia is around 20.6%, and hemophilia B is 5.3%. Now, the degree of severity hemophilia is, what is the normal factor? Factor number 8 or number 9 level is around 50 to 150% of the 100 ml of the blood. Mild hemophilia will be deemed as 6 to 50% in 100 ml of blood, and moderate hemophilia will be deemed as 1 to 5%. So these all are which when you see cases, you learn. So one is family history, symptoms, then hemostatic collagens, then if patient goes for surgery or tooth extraction or anything, then the bleeding will be continued. So if the bleeding is continuously there for more than 4.5 seconds, 50 seconds, then we have to suspect that he is a hemophilic. Then types of bleeding: joint bleeding, that is known as hematorosis, muscular hemorrhage, soft bleeding, life-threatening, other bleeding episodes. What are the life-threatening bleeding? Nausea, vomiting, headache, drowsiness, confusion, visual changes, because this happens in intracranial bleeding. And in neck and throat bleeding, there will be pain and swelling and difficulty in breathing, where the neck muscles, throat, as well as trachea and esophagus will be compressed because of continuous bleeding in the neck region. So we should be very careful. And life-threatening bleeding is in GI tract. Usually this happens. This will happen only in the first beginning of the diagnosis, but later patient will understand, and doctor also knows the history of the patient, so it can be easily manageable. Then iliopsoas bleeding, where there will be back pain, there will be abdominal pain, tingling, numbness, decreased range of motions. The other bleedings are mouth bleeding, nose bleeding, scrapes and minor cuts, where children, when we cut the nails of the children, there will be a nail bite or injury when we are cutting the nails. So that bleeding also will not be stopped for a long time. So we have to always suspect that hemophilic condition. And there will be a family history in that condition. Then flexion contractures, joint arthritis, chronic pain, muscle atrophy, compartment syndrome. Compartment syndrome is pain at particular joint with bleeding and swelling, and neurological impairment will come. What is neurological? Atrophy of the muscle. So the treatment of hemophilia is replacement of missing clotting protein, or demopressin, or factor 8, replacing the factor 8, factor 9. But always replacing the factor 8, factor 9, there is a limitation that more than 180 times, if one takes the factor, there will be resistance to the factor. These are the cases where homeopathic treatment is needed, because we have to see that body has to accept the factor, as well as immunomodulation has to be taken, and there should not be any excessive resistance for accepting the factor in the body. That is known as hemophilia factor resistance hemophils. So the factor resistance hemophils will be usually treated with homeopathy, and homeopathy takes care of such things. This I will show you in future slides. The treatment of hemophilia: antifibrinolytic agents, supportive measures. The physiotherapy treatment is icing, immobilization, rest, complementary and alternate systems of medicines, particularly homeopathy. See, homeopathy has been found to be more effective than Ayurveda and Siddha treatments. And the adaptability of homeopathy is very easy among the children. And homeopathic medical preparation is too easy. And the homeopathic medical cost is very easy. Moreover, the homeopathic doctor orientation and their syllabus is like allopathy. So the Hemophilia Society or the Hemophilia Federation of India has accepted homeopathic treatment. This is the Pondicherry is the second center after Bombay, where the homeopathic treatment is simultaneously given to the patients of hemophilia and hemophilia affected children. So prophylaxis, there will be always prophylaxis giving fibrinogen and giving factor once in a year, just like that whether bleeding is present or not. But the factor costs much and without any symptoms they will give. So in a hemophilia patient, there will be a psychological issues because the children will feel that they won't have so much of maturity to adjust to the society. So they feel guilt and they will take hospitalization as a challenge, and nobody understands why the bleeding is continuing and what is wrong with their body. So there the counseling is needed, and the homeopathic treatment, which is proved on healthy human being, will also control the guilt, the psychological challenges, the social feelings, and financial insurance challenges, because the factor costs around 4,500 rupees even as on today. So getting a factor is another toughest task. So people will come for homeopathic treatment. Then nursing considerations, avoiding acids, because there will be pain in the knee joint, pain in the elbow joint, pain in the wrist joint. There will be painkillers, and these painkillers will increase the bleeding time. So the patient is forced to come for homeopathy. So hemophilia treatment, the patients and family, what treatment centers, what team members we do. We will counsel the patient and family. There will be one hematologist, there will be a nurse, there will be a social worker, there will be a physiotherapist, there will be arthrodontist, and they will teach everything, where the homeopathic treatment simultaneously will be given to patients of hemophilia. What we will do, we will take primary care, infectious disease control, genetics, pharmacy, dental, and hepatology. What is the role of hemophilia treatment centers? What we do, we educate, we do research, we will go to reach of the patient, we will find out the new patients. The model comprehensive care of chronic disease will be taken as per the homeopathy guidelines, and the state of the art of medical treatment will be given to the persons of hemophilia, and their lifespan will be increased by giving homeopathic treatment when we combine simultaneously as a supportive treatment, as an adjuvant treatment, as a treatment along with allopathy. What are the complications of the treatment? When we take the treatment, the patients will have severe bleeding. When he takes factor, when there is blood contamination, there will be always a resistance will be low, immunomodulation will not be up to the mark. So patients, children, because of eating habits and drinking habits, they will develop hepatitis B, hepatitis C, and nowadays the hemophilia patient will have HIV too. This is the intracranial bleeding patient. This is bleeding in the left knee joint, and this is the wrist joint bleeding. This is the right knee joint, and both the knee joints have been swollen because of the intra-articular bleeding. This is the tooth extraction bleeding, and where we start research and need of research, where the homeopathy is being managed. In this, our Pondicherry unit, we are giving collaborative treatment and an interdisciplinary treatment, where our Hemophilia Society has got a reputation, and that is the reason our president got the award of Padma Shri. And this is the hemophilia case record. This is absolutely a homeopathic case record, where we have to note down everything from age, name, and sex, the factor level, any other family member, past history, family history, birth, early age. You can download this aggravating food item, a typical homeopathic case record. Then this is the repertorization. What we will do in repertorization is, see, I have noticed here, you can see this, all normal repertorization along with the mental symptoms done at that time. See, here the calcarea carb has scored maximum score with maximum symptoms of 43. After calcarea carb, sulfur with 44 symptoms and 44 score and 17 symptoms. Calcarea carb 43 score with 19 symptoms. And the other drug is 45 score. This is laxis and 21 symptoms. The maximum coverage is for laxis, followed by sulfur, then calcarea carb, then arsenical. And these are the medicines which were prescribed. And this is a repertorization slide. And according to the need of the patient, according the dependency of the patient, each has been, these are the all the symptoms that is covered. These all are hemophilic symptoms. Repertorization for disease diagnosis, hemophilia, and again constitutional repertorization. These symptoms definitely will come apart from this: fear, anxiety, then phobias, and internal bleeding, depending upon the each constitutional patient, each constitutional history of the patient, the repertorization will change. These pathological symptoms are bound to come. Then the center has created an integrated in the Maulana Azad Hospital, New Delhi, where Prime Minister has opened. This integrative medicine is becoming more popular because homeopathy is continuing. Homeopathy is controlling various disease conditions, particularly in hemophilia. The success has been seen. You can see this. I will open this. You kindly download this. This is now this integrated medical practice is becoming very common. So homeopathy is curing all the super specialty disease conditions. And homeopathy also understood the limitation, and homeopathy in research is clicking very good. So this is Dr. Kanjakshara Ghosh. He was head of the department of Hemophilia Society of Bombay, as well as Hematology Department of former Director of Indian Council of Medical Research and Hematology. He told that homeopathy and allopathy combination help to cut the treatment costs of hemophilia. And this is where we stand. This is the article where gene therapy in allopathy will help hemophilia, but this gene therapy will hold hemophilia only for 2 years, whereas homeopathy is holding hemophilia patient for a long time. From 2008, I have been given an opportunity to treat the hemophilic patients in hemophilia chapter of Pondicherry. From 2009, the patients who are in need of treatment, whether allopathy or homeopathy or factor, they are being managed with homeopathic treatment. And I will show you, these are the particulars of the treatment of Salem chapter. In the beginning, I was first homeopathy in 2008 was tested on 28 patients, and the patient treated were 13. Patient responded were 8, and 5 patients have been not responded. So basing upon these 8 patients, I have been given a full opportunity along with the research facilities where the mechanism of the action of the medicine is understood. What are the symptoms of particular patient? Pain and swelling in the shoulder joint for these 13 patients, and found effective in 8 patients. I will go just for new slides today, which I prepared because we have less time. So these are the medicines prepared, and we found in 8 patients effectiveness of homeopathic medicine. And when we found that there is something coming out of homeopathy for hemophilic patients, so I was deputed to Salem chapter, where 56 patients of hemophilic hemophilia were screened, and we have taken 43 patients. Out of 43 patients, 22 patients have responded very well to homeopathic treatment. This treatment in Salem used to be in an allopathic pediatrician nursing home, where he used to guide me. He used to be the nodal officer, where homeopathic treatment. This is not government. This is all private. The Hemophilia Federation research. This is nothing to do with my CCRH or with anybody. So the 22 patients started responding. So that hemophilia, that pediatrician asked me, where is your homeopathic factor? So when I have shown him the bottles filled with alcohol, then I told, sir, it will work like factor, but it is not factor. So you have to understand a lot. Then he asked me how it will, what is the mechanism, how it should be infused. So by that time, I explained much time. Then when patient has improved, he believed. So these are the 43 patients where we have treated. And this is the pathophysiology of the arthropathy, where this is the normal, this is abnormal. This side is abnormal, this side is normal, where the pathological changes will occur. I have shown in my previous slides also. For newcomers, kindly download and go through it. This you will understand. This is hemophilic arthropathy. This is normal joint. Then this is the cytokine, what the anti-inflammatory, pro-inflammatory cytokines that are present in the body. They will take change in the pathology of hemophilia. Pathology has to be reversed with homeopathic treatment by selecting an individual prescription, a constitutional homeopathic prescription. And these are the cytokines targets that have been identified in hemophilia. You have to kindly see so that you will understand what is the pathology, where these cytokines level, this is the article, these cytokines levels have to be estimated in each hemophilia patient when he has been treated. So hemophilia and joint disease, this is the pathophysiology evaluation. This article also you can read. The cytokines in pathogenesis, what happens? IL, interleukin 1B, interleukin TNF alpha, interleukin 6, interleukin 2, and these will change. This is known as catabolism. This is known as anabolism. This is hemophilic arthropathy. This is normal. So these are the hematorosis that will take place because of these TNF alpha, and this is the normal which will maintain the joint inter-articular blood flow. So this is the anti-inflammatory cytokine. When we are doing research, we will not be given more than 6 weeks of duration to test the efficacy of the drug. So the blue color is the drug, the red color is the placebo, and the blue color, that is first week, second week, third week, fourth week, fifth week, sixth week, and by sixth week, the IL-10 at 6 week has reduced. So whereas in placebo, the IL-10 at 6 week has increased. In the beginning, it has increased in the second week, third week, fourth week, fifth week. But at the end of 6 week, the IL-10, this is anti-inflammatory. That is, the inflammatory condition of intraleukin in the blood has been reduced by calcarea carb. In the first week, I have given arnica, then going to Merxal, then going to arnica, then belladonna, then calcarea carb, the calcarea carb at last. That medical needs another have to talk it later. Then this is anti-inflammatory cytokine, where the anti-inflammatory condition will increase. By that, the pro-inflammation, by pro-inflammation, where the body is getting the disease, that will be controlled. So the anti-inflammatory condition at the end of 6 weeks has increased so much that the 6 weeks of treatment has been found to be very good. But according to homeopathic constitution, the hemophilia is a genetic condition that comes under multi-miasmatic disorder. Again, the miasmatic talking is a nomenclature applying to the pathology. So that nomenclature depends upon us. That's why we haven't taken the miasmatic attitude or the miasmatic consideration into research. But when we have given treatment, we have taken miasmatic symptoms. We have also written the miasmatic prognosis and miasmatic case taking. But all these are the miasmatic outlook. There is no miasmatic biology that has been tested either in homeopathy, or we can't take up that in research, because the miasmatic biology.
Yes, this is the technological pathology. Always developing some problems during this our seminars. They're expecting for the 5G technology to arrive at their list. Just pray for that. Yes, Dr. Prakash Rao again join, sir, please. He can control
Can you
the
hear me, sir?
hemophilia, but he can control this. Yes, sir, please.
Can you see the slide, sir?
No, sir, you have to restart it.
Yes, sir. This is the double-blind randomized methodology,
Yes,
where
sir,
we have
sir,
taken the
excuse me, sir. Excuse me, sir. You have already presented all these things. Please proceed.
Yes, yes. Now, this is where, when we do the research, we have to see that the research that where the biomarkers have been changed, there will be an in vitro procedure. That in vitro procedure will be deemed as more scientific, where the medicine will be kept on lymphocytes of the blood. The lymphocytes have to take change. Those changes were also found in homeopathy. The total mechanism of the action of 5 homeopathic medicines, Arnica montana, arsenic, phosphorus, sulfur, calcarea carb, and laxis have been tested. These are the changes. The clumps of lymphocytes have been changed. These are the third. This is clumps of lymphocytes, slide 2. This is clumps of lymphocytes, slide 3.
Now it becomes an intermittent disease. Yes, sir, please. You're unmuted now, sir. Please unmute, sir. You're muted. Sir, we can't hear you. Please unmute, sir. Again, network.
Hello.
Yes, sir. No audible. Please proceed.
Can you hear me, sir?
Yes, 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 sir.
Okay, sir. So what is the achievement of Hemophilia Federation of Pondicherry? We train the doctors, we train allopathic doctors for proper hemophilic care, where the homeopathic doctors also we will train. We organize workshops, we provide them the homeopathic medicine prescription, and we have 2 reference centers. One is CMC Vellore and Jipmer Hospital. In case of serious patients, we will refer them to Jipmer Hospital. In case of intracranial bleeding or surgery is needed, we will send them to Jipmer as well as CMC Vellore and rest of all the patients. Now, what is specialty of homeopathy and Hemophilia Federation? Why it got name is the total number of patients enrolled in Hemophilia Society of Pondicherry are 372. The number of patients in need of treatment are 65. The number of patients on homeopathic treatment are 65. Patients only exclusively on homeopathic treatment are 46. Patients with integrated approach, that is homeopathy and factor combination, are 19. The total number of patients are 65. They are in need of treatment always from last 2008 to 2023. They are under observation and they are constantly being monitored by homeopathic doctor, by a hematologist. So what are the symptoms? Pain and swelling of the shoulder joint, pain and swelling of the elbow joints, pain and swelling of the knee joints, psoas bleeding, bleeding from gums, bleeding from nose, bleeding. See, these are the patients. This is the number of the patients found effective. The total number of patients taken for exclusively homeopathic treatment are 46, and patient found to be effective and 31 patients have got relief, and these 31 patients are under treatment from 2008 to till date. And what is the age group? 1 year to 10 years. 1 year to 10 years is when in 2008. 2008 plus 12 years. Now that patient age is around 20 years. So more than 20. See, these all statistics were taken in 2008. And when I have seen for this seminar, when I noted down, so out of, see, number of patients from 1 year to 10 years, 6, 1 year to 20 years, 16, 1 year, at the starting of the treatment. Please kindly don't confuse between treatment and this one, sir. And what happened today, the swelling of the shoulder joint. See, this is the swelling of the shoulder joint. You kindly see pain and swelling in elbow joint, pain and swelling of the elbow joint, pain in the knee joints, swelling of the knee joints. See, this is even needs. See, swelling of the joints from zero, in the sense from 2008 to 2023, it was first in 14 patients, it reduced to, see, 14 patients have reported, that 10 patients have noticed. There is something in the slide. Now you can see, there are 3 colors, sir. The swelling is in blue color, the red color is pain in the shoulder joints, the green mild orange color is pain in the elbow joints, and blue color is swelling of the elbow joint. Again, the light green color is pain in the knee joints, and the red color is swelling of the knee joints. See, 14 patients, it has reduced in 10 patients, and in 6 patients we found pain in the swelling of the elbow joints. It has reduced to 4 patients. Swelling of the knee joints has been noticed in 6 patients, and it has totally came down in 4 patients. So this is the ultimate result. And from last 2008 to 2018 and 2023, from last 15 years, these 45 patients are absolutely on homeopathic treatment without any factor. They have grown now. I have seen a child of 2 years. From last 15 years, now he is around 17 years. One is around 18 years. They all have grown. They are being managed with homeopathy. Only 16 patients were in need of homeopathy and allopathy combination, and 2 patients became worse out of these 372 patients. And because of corona, because of various other associating disease conditions, 2 persons have expired from last 2 years because of congestion, because of cough, because of various disorders associated with corona. This is the Hemophilia Society of Pondicherry we are doing. And sir, I spoke very fastly only to have a discussion with you so that we can. Thank you very much. I will stop speaking.
Yes.
Thank you, sir.
Okay. Very nice presentation. And it's time for discussion. Those who would like to participate, please go to the participant list and raise your hand. And of course, it's a wonderful presentation. We must all congratulate Dr. Prakash Rao for doing such a fantastic work with the homeopathic medicine and studying a lot of things. It's the greatest research work, I think, in the history of homeopathy, especially in India. Now, of course, our special guest, Dr. Beatrice Desar, is there. Yes, madam, please proceed.
Yes, thank you very much. And Dr. Prakash Rao, it's very impressive, your work. And many congratulations what you are doing. So my question is, can you say something about the potencies you are using?
Excuse me, madam. Can you please kindly repeat your query, madam?
Yes. Treating your patients with hemophilia, can you say something about the potencies you are using and how often?
Yeah, madam. That I am asking them. If they give permission next time, I will show you calcarea carb, arsenic album, phosphorus, sulfur, and arnica montana with merxal and laxis. Out of these 7 medicines, 5 medicines have to be found to be very effective. We have given the potency starting from 30 and 201 m. We haven't crossed 30, 201 m. We started in the beginning with 6 potency, but 6 potency could not, we could not see any results. But we have seen fantastic result with 30 potency and good results with 200 potency. And we could not see so much of relief with 1 m potency. Whatever the repetition, that whatever the relief we noticed in 200 potency has been noticed in 1 m potency. The maximum relief came from 30 potency, and half of the relief, suppose I have treated 46 patients. These 46 patients have responded. That is the percentage. What we will tell is the 80% of the patients out of 45, 80% means around 38 patients have responded with 30 potency, not with 200 potency, and 3 patients responded to 200 potency, and 1 patient responded to 1 m potency. But we could not go for higher studies because the higher potencies, they will not be allowed to be tested. So the test, that is pro and anti-inflammatory cytokines reversal, has to be noticed. But from last 10 years, I am giving the higher potency. But it is only a psychological eye to found that because once the patient pathology inside is changed, he himself managing with the physiotherapy as well as with his maturity. So absolutely no homeopathic treatment is needed. But we will conduct every month 1 camp to see the assessment of our prescription, how we are managing. So from last 13 years, we are managing. Almost all the patients from last 10 years are on placebos. And highly effective potency is 30 potency.
And thank you very much for that very good answers, sir. And how often would you repeat this T30? Would you start to give it every day in the beginning, or how would you manage?
No. Whenever he complains, then only the medicine will be given. That also happened only for 2 years, till the patient achieved around the age of 15 years. After that, absolutely homeopathic treatment was not necessary, number 1. And always, whenever he comes, he is on placebos. Only the new patients will be administered now medicine, because we stopped doing research, because we are confident that where the homeopathic medicine is effective, and depending upon that experience as well as constitutional prescription, the homeopathic constitutional prescription, if I think that my experience of treating hemophilia with calcarea carb is too good, but that never works out on a new patient. Each new patient is again a new case. Again, I will start with belladonna. Again, I will start with arsenic album. Then only I am getting relief, because the individuality, that is something, the individuality also scientifically known as autoimmunomodulation. That immunomodulation will be understood by the symptoms and case-taking procedure of homeopathy. The most scientific attitude of the latest science is understood the oldest methodology of constitutional prescription of homeopathy. So homeopathic constitutional prescription helps achieving the modern scientific goals. So the new patients, because our state contains only 372 patients, out of that 65 patients only need medication. Out of that, 45 are exclusively treated with homeopathy. Rest of all the patients need only just a supervision and a physiotherapy. So these 46 patients are given homeopathic prescription. From last 5 years, they are also on placebos. That need separate seminar where homeopathy and hemophilia. This is, as a researcher, I want to tell that we are managing the Hemophilia Society after undergoing this research studies.
Yes.
So various 21 medicines have been tested. After how these medicines came to how we came to conclusion is, first we have taken all the symptoms of the hemophilia patients. Then we screened all the patients with repertorization. Then we found the medicines that have scored more than 10 marks in repertorization. In 10 marks, which covered the pathological symptoms of hemophilia, at least 10 marks, and 3 symptoms must be covered with that medicine. Then we have bleeding disorders, because in those days our textbooks don't have a word like hemophilia. So bleeding disorders, starting from bleeding injuries to bleeding piles to bleeding hemorrhages to uterine bleeding, every bleeding symptom has been taken. From that, the 10 medicines, 11 medicines have been thoroughly studied. Then their pathophysiological action has been studied. Then their toxicology has been studied. Then their medicines found up to the 12th potency have been studied. Pharmacologically, their toxicological effect has been studied. Then the 30 potency of the medicine of Byron company has been ordered, and that 30 potency, 6 potency, 200 potency, 1M potency, according to the homeopathic, one single dose in each week has been studied in research. Once the research results are successful, from last 5 years, all the 46 patients are on placebos. If they are getting any other disease or some other, because of corona or anything, they are consuming other system of medicine, and their hemophilic trouble is being controlled by homeopathy.
Okay.
And they use in between because of the calcarea biochemical remedies like that. But they are confident that homeopathy could control their disease.
Okay, sir. There's a question from Dr. Resa. What is the remedy for anemia after inflammation?
What is the remedy for?
Anemia after inflammation.
After
inflammation.
I see, sir. Mercurius. The anti-inflammatory drug is mercury, sir.
Okay, thank you.
You can relieve the symptoms, but you cannot control that for a long time.
Okay,
sir.
Right. Yes. Dr. Hubert, please proceed.
Hello, can you hear me?
Sir. Good evening, sir.
Thank you, sir. Thank you very much for your wonderful presentation and reaching to our great science. So, sir, I want to ask you, while you using calcarea carp, is it the medicinal aggravation seen in the 4th weeks after that? Yeah.
You have asked a wonderful question. Nobody gets medicinal. Yes, sir. Where a drug that treats medicinal aggravation also comes as the individual prescription, because the autoimmunomodulation, one patient's symptoms will be entirely different. One patient pathology also will be entirely different. But the immunomodulation will be almost same. In the same fashion, when the drug cures, it also produces the side effects, sir. Why calcarea carb I am talking is the physiological action of hemophilia and the chemical present and chemical action of calcarea carb are one and same, because the anti-inflammatory cytokines, they are produced from bone marrow. So calcarea carb affects the bone. Almost the symptoms that are present except hemorrhage, every symptom is present in calcarea carb. And the hemorrhage is also in between the joints and not outside. So the calcarea carb covers most of the symptoms. If we skip some of the mental symptoms, if we are overconfident, the repertorization covers almost medicines like this: calcarea carb, palacetilla, silesia, sulfur, phosphorus, and arsenical. These 5 remedies will cover almost all the symptoms of any disease condition. But we have to see the pathophysiological action of the calcarea carb. and Kalkariakar do
Okay.
produce side
Yes,
effects
sir.
if it is given
Now,
in
Dr. Veena,
potency,
please proceed.
but
Dr. Veena,
it
you
is
can
1%, sir.
Thank you, sir. Thank you, sir.
1% case we won't get. Out of 100 cases, we have to get one case. So that one case may react. Every homeopathic medicine will have side effects, sir. This has been observed by Kent. If you read Kalikarp, if you read Epis mellifica, if you read Silesia, he says these drugs are double-edged swords and they will spoil the patient. That's why the Kalikarp, potassium cyanide, Kalikarp has killed various persons because of the side effects of the drug in hypothyroidism and in malignancies. So when we get more and more patients, we cure at the same time, there will be a chance to observe the side effects of the drugs. If we get less patients, our observation will be limited to lesser things.
Yes, sir.
Sir.
Thank you, sir.
Okay,
Thank
sir.
you, sir.
Yes.
Thank you, sir.
Now, Dr. Veena, you can please unmute Dr. Veena.
Yeah,
Yes.
good evening, sir. Sir, and indeed we are very grateful to you for the 5 long series of presentation on hemophilia, sir, because it is an eye opener, and I have good experience of treating 2 patients in my life on hemophilia, and one had a serious liver hematoma, and he was planned for a hematoma surgery, which was 12 to 20 hour long surgery, and with arnica for a month. He never had a bleeding episode in the surgery table. He successfully underwent the surgery, and he is now, he was 45 at that time, he is 60 plus now. So this life which has got, I owe to homeopathy and the medicine arnica, wonderful medicine arnica.
Yeah, you are correct, madam. Your observations are right. The hematoma, if it is in acute form, if the duration of hematoma is very less, arnica montana and Merxol, arsenic album, they will treat. But the hematoma, that is psoas bleeding, where intra-abdominal bleeding will be present in psoas muscle, if it is of more than duration of 3 months, patient will have cramps and different symptoms. They won't cut, they don't do surgery because the blood has to be given, the factor has to be given. So they will do ice application. There the medicines like mercury, medicines like Kalkariakar, medicines like phosphorus, excellent medicine. You have given arnica. There is another medicine for hematoma is sulfur. And we will find fantastic
And
results.
your class helped a lot on the arnica effect on interleukins.
Only difference is I know where the medicine acts because I know the cytokines. I am sure, but that surety never works out in homeopathic individualized prescription. We have to each day for each case we have to do homework and read. Then only we have to apply because the homeopathic medicine's mechanism of action, what the research I am doing is disease-wise research. But if the animal proving takes place means we can understand where the real medicine on which system it works, how it produces the symptom, how it cures the symptom. That research is lagging. That's why despite of doing so much of research, the hard work cannot be avoided in homeopathy.
True, sir. True. And hats off and a big salute to you, sir. It's a real service to the humanity, and especially for the genetic diseases, which is presumed to be incurable.
Yes.
Where is
See,
very
madam, one thing I am telling, I am coordinating with my president. She is a pediatrician. We have a hematologist, we have a pediatrician, we have a general physician, we have a orthodontist. There the homeopathy has been introduced because I happened to be in research. I gathered the total patients, they are present in the state of Pondicherry, and the new patients that are going to come every year. In the previously around 12 years back, I started screening the hemophilia patients. The Hemophilia Society of Pondicherry started in 1990. In 2008, I joined. When I joined, there were only 102 patients. After that, I have gone door-to-door survey and incidental medical aid, testing the factor. In those days, it used to cost around 2,500. I used to take the samples there, then send the samples to Jipner, diagnosing the hemophilia. After diagnosing, the total state with 16 lakhs population is having 372 patients. Out of those 372 patients, the 65 patients on and on fall sick, and managing the 65 patients by the government, despite having so much of medical infrastructure, became very difficult. So the homeopathic doctor was called. Those are 46 patients on and on. They will be on homeopathic treatment. These 46 patients below the age group of 60, below the age group of 20,
Yes, sir.
the total 46 patients have been controlled and they are leading a good life.
Yes, sir.
That credit
Okay.
goes to homeopathy.
Yes, sir. In have to leading a good life, we need also the time restrictions also, sir.
Yes,
Okay,
sir.
sir.
Yes, sir.
Anyway, we are very happy to hear from you more times. There is
So
no,
this is made the total systematic study made us to get
yes,
the
sir.
Homeopathy
Yes.
award
Yes.
this time.
Now it's time to wind up the session. May I
I
invite Paris, sir, to some sort of thanks.
happen to be the team member. That's why.
Paris, sir, are you there?
Benefit.
Paris, sir. Yes. Please, sir. Please proceed.
Sorry, I just joined. I could attend due to some net problem. Just
Okay.
joined only. Then
Okay.
kindly. Okay.
No problem, sir. Yes, Beatrice, madam, please. Madam Beatrice, just sir, please express order.
Okay.
Thanks, yes, please.
Okay, so thank you very much for your nice presentation, and you give hope to these children who have that genetic disease. That's something very spectacular, very special, and also proving to the medical world that these things are possible. Many congratulations and thank you very much, also to IFPH.
Yes. Well, okay, thank you. Well, that marks the end of today's session. And of course, we are approaching the 900 days historical milestone in 3 short of the 900. We'll have some celebration on that. That will be declared later. Anyways, trying to wind up the session, may I invite and hope you will meet same day tomorrow. Till then, goodbye. And it's all to Dr. Ayar Ashok Kumar to continue the program in Malayalam. Thank you.